What does a woman recently diagnosed with breast cancer want from surgical treatment? While this is a common question, there are some women, rather than stating what they want, have expressed what they do not want. As reported by this team of researchers, some women do not want to take chances when choosing the type of surgical operation to undergo. But allow me to ask, is this concept of not wanting to take chances and how patients achieve it consistent with the available evidence? Let us explore this together. In many of my other videos, I have discussed briefly the two broad categories of breast cancer surgical treatment. One is breast conservation treatment, and the other involves mastectomy. More details about this are presented in my other videos. For this video, we will be discussing the concept of women not wanting to take chances in choosing surgery, for which the data discussed is solely for educational purposes and does not replace a medical consult. Please see your doctor for treatment planning. Let us return to review this article, which was published in 2018. It was reported that to fulfill their wish not to take any chances, more women undergo CPM. CPM is short for contralateral prophylactic mastectomy. This means that the patient had elected to undergo a mastectomy for the diseased breast, together with mastectomy for the uninvolved breast. When both breasts are removed, it is medically termed as bilateral mastectomy and is commonly called double mastectomy. For this video, I will focus on published articles about patient concepts on treatment choices and research data on therapeutic outcomes to review if they align. As some of you would already know, in 1991, the National Institute of Health of the United States issued this consensus statement. At that time, breast conservation treatment was considered an appropriate method of primary therapy for the majority of women with stage 1 and 2 breast cancer, and is preferable because it provides survival rates equivalent to those of total mastectomy while preserving the breast. Based on this consensus statement, one would have expected that more women would undergo breast conservation treatment. However, this was not the case, and it was observed that breast conservation treatment was underutilized soon after the statement was issued. Then, in 2017, more than 2 decades after the previous article was published, there was this cry from renowned experts in the field of breast cancer. There appeared to be a sense of exasperation that there were too many mastectomies performed in the United States. The authors of this piece said that increasing use of mastectomy is a patient-driven trend. This comment was further supported by a report published in 2024. This team of doctors found that from 2017 to 2021, patients at their institution were increasingly choosing to undergo bilateral mastectomy, BLM for short, for the treatment of unilateral breast cancer, abbreviated as UBC, meaning cancer within one breast. The rate of CPM increased nearly threefold over the past 2 decades, so this trend has not abated in some geographical areas in spite of experts' call to reduce mastectomy rates, as we saw in the previous article. Looking at this excerpt again, we see that many survivors found that, having had CPM done, they had physical and emotional challenges after surgery for which they may not have felt prepared. Body image was also a concern. This is consistent with a study performed in Sweden in 2012, where more than half of the women who underwent contralateral prophylactic mastectomy felt less sexually attractive, and they were also dissatisfied with their body and the appearance of their scars. Was this what patients were prepared for when talking about peace of mind? There are many considerations that I make in the clinical decision for the surgical treatment of women diagnosed with early-stage breast cancer. In this video, which is the one part of several videos on this subject, I shall focus on 2 outcome data points. Let us look at survival and local recurrence. Some of these articles are different from those I discuss in other videos, but essentially, the results are similar. This is a systematic review and meta-analysis of observational studies comparing breast-conserving surgery versus mastectomy for non-metastatic breast cancer. A meta-analysis is a statistical calculation of the combined data in studies which meet certain stringent criteria. Published in 2025, the analysis demonstrated significant benefits of breast-conserving surgery on overall survival. There was a substantial improvement in overall survival at 5 years. While there was heterogeneity in results, the better survival rate was consistent across different countries. For comparison, here is an earlier study performed by another team of doctors. This 2022 publication also came to the same conclusion that overall survival is better in patients who undergo breast conservation therapy compared with mastectomy. With respect to 5-year local recurrence rate, a meta-analysis published in 2024 found that there was no significant increase in the overall recurrence rate for patients with breast cancer who underwent breast-conserving surgery compared with those who underwent mastectomy. Having had the opportunity to review some of the data, this consensus statement on breast cancer surgery from a panel of experts who convened for the 2025 edition of the St. Gallen International Breast Cancer Conference will not be surprising. While the panelists strongly support patient choice in the decision of the type of primary breast surgery, they also believe that patients should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results and other positive outcome metrics which I shall discuss in other videos. At this point, having presented data comparing breast conservation treatment and mastectomy, only in terms of survival and local recurrence, the evidence shows that women who undergo breast conservation treatment enjoy better overall survival and similar local recurrence rates, among other favorable outcomes which I will discuss in other videos. Knowing this, would undergoing mastectomy and contralateral prophylactic mastectomy actually provide a woman with peace of mind? Does a patient know what she will actually exchange for peace of mind if she has a double mastectomy? Or does mastectomy represent overtreatment in many cases? I trust that the data presented has left you with food for thought. Thank you for staying until the end of the video. All the references cited are available for you to verify and fact-check. I hope that the evidence presented has been useful to empower you or your loved one to make a decision regarding the choice of breast cancer surgical treatment that will help a woman live longer and live more as a survivor. If so, please like, share, comment, subscribe, and join me in the next video. Until we come together again to discuss more truths about breast cancer surgery, take care.